The 2-minute walk test is an outcome measure that assesses endurance and static gait, or gait that is without obstacles or secondary tasks. It allows insight into patients' endurance, gait speed, and potential for household or community ambulation. This video is going to show you how to perform the 2-minute walk test, measure a patient with accuracy, and then discuss how a patient's performance can be used in a clinical setting. Preparing for the 2-minute walk test begins by finding a location. Try to find open areas with minimal foot traffic and attempt to limit the number of turns required. At best, a 50-foot walkway would reduce the impact of turning on a patient's performance. A variety of other pathway types can also be used in place of straight line walking, such as walking in an oval pattern or in a figure-8 pattern. We recommend using a measuring wheel to ensure that you have an accurate measure of distance. However, it is common practice to use other methods of measurement. Examples include known hallway or clinic links and counting standard ceiling or floor tiles. While these can work to get a fair measure of distance, they're much more prone to error due to miscounting or guessing. Assistive devices can be used for the test, but they should be kept consistent and documented from test to test. If the patient requires physical assistance to walk, this test should not be performed. To begin the test, instruct the patient by saying,
"Cover as much ground as possible in these 2 minutes. Walk continuously, but if you need to slow down or stop, don't be concerned. The point of this is to feel as though you have covered as much ground as possible in these 2 minutes."
Follow the patient with a measuring wheel, or keep count of distance, ensuring that you take note of distances covered during any turns. As applicable, try to avoid walking in front of or immediately beside the patient, as they may assume your gait speed. At the end of the 2 minutes, have the patient stop and rest, and note the full distance covered. The test result, expressed in feet or meters, can be used for comparison to normative data over time. And there are published normal data for the 2-minute walk test for adults of most ages and for many pathologies. As an example, a 67-year-old male patient performs the test walking a total of 312 feet. When we look at normative data, we see that we should expect about 600 feet for an individual of that age and gender. Therefore, we can set a long-term goal for the patient of reaching the expected 600 feet in 2 minutes. With this test, we also want to look at a very important property of any outcome tool, the minimal detectable change, or the smallest detectable difference. This value can be used to determine if a true change has occurred with the patient. It enables us to make short-term goals in the patient's progression, repeating the test throughout the plan of care. As an example, the minimal detectable change for an individual following a knee replacement is 49.1 feet. If we measured a patient after knee replacement and they exhibited an improvement of greater than 49.1 feet, we can be confident that a true improvement has occurred. Thank you for watching this video, and we hope you can bring the 2-minute walk test into your clinic. If you want to learn more about this test, including current statistics and the normative data discussed earlier, Gait has a free 2-minute walk test toolkit available for download on missiongait.org under the Education tab. If you want to see more of Gait on YouTube, click the link in the corner to subscribe or visit our YouTube channel at youtube.com/missiongait.